Hello, my name is Yolanda Washington. Welcome to my Module 5 video presentation. My presentation is on appendicitis. I chose appendicitis because it is something that I've dealt with personally within the last year. Appendicitis is when your appendix becomes inflamed. The cause of that inflammation could range from bacteria in your stomach, a virus, or just an infection. In my case, it was due to an infection. Some of the signs and symptoms were bloating in the stomach, gas. It can also be pain, sharp pain on the right side in the lower abdomen area, or you can also get pain around the belly button that radiates down to the abdomen area. But mainly, it will feel similar to sometimes gas pain or extreme pain. In my case, I had a couple of the situations where I didn't eat. Lack of diet, appetite is one. Also, nausea, vomiting. And so in my case, I just had the gas and the pain in my lower right abdomen. And so with that, treatment is a couple things. They are now starting to experiment with a antibiotic that deals with the infection. If they can catch the appendicitis soon enough, they treat with antibiotics to see if they can't heal the infection in the abdomen. However, 99% of the time, you can still end up with a ruptured appendix, or the inflammation can return. So the actual cure-all for appendicitis is what they call an appendectomy. And with the appendectomy, there's two ways that they can do it. One is laparoscopic, and that's where they can just make little small holes and go into the abdomen area and remove the appendix that way. Or the second is the one that I had, and that's where they call it an open appendectomy. Because I had a ruptured appendix and it wasn't clear what they could see, they actually opened me all the way up. And when they got in, there was enough damage to where it had killed off part of my large and small intestines. Now with that, an appendectomy is considered an emergency surgery. And so because it was so extreme, and they had to do what is called a full bowel reconstruction. So with a full bowel reconstruction, they had to make sure that they got all of the infection out, and also they took out the appendix plus part of the large and the small intestines that had died off. And so that was pretty much an extreme part of it. Most appendicitis is not that extreme. It is very something that they treat constantly. 1 in 1,000 people deal with appendicitis every year in the United States. It is very common between the ages of 10 to 30 years old. However, it could happen at any age. It was very uncommon for it to happen at my age. And then you also have the elderly. It's very common in the elderly that can get a blockage or bowel obstruction that could also cause a ruptured appendix. It is very prevalent today, although they're making strides in ways of treating it. However, because they're not quite sure of how an appendicitis comes about, they still don't know what actually causes it. They just know some of the things that can and may cause issues with the appendix. However, there's just really no firm evidence on why our appendix ruptures. So I hope that information was helpful for you, and thank you. And that's my presentation on appendicitis.